Welcome back to our clinical education series. I'm Nurse Succinate, and today we're exploring one of the most demanding yet rewarding areas of nursing: critical care and advanced nursing practice. In this lecture, we'll break down assessment, monitoring, patient care, and what truly separates basic nursing from advanced nursing. Let's begin. Critical care involves patients who are acutely ill, where vital organs are compromised or at risk of failure. These patients show deviation from normal vital parameters, and any abnormality may be life-threatening. Critical illness triggers a stress response, which occurs in two phases: the ebb phase and the flow phase. Understanding these responses helps us manage critically ill patients effectively. The ICU itself is a major environmental stressor. Noise from alarms, constant lighting, sleep disruption, and loss of privacy can cause anxiety, insomnia, and even ICU psychosis. As critical care nurses, we must recognize and reduce these stressors to promote healing. Assessment in critical care is continuous and systematic. We assess physiological parameters, heart rate, blood pressure, respiration, but remember, these may not always reflect the true severity. We also assess psychological status, pain, anxiety, sleep, and coping ability. Critical care nursing means watching trends, not just numbers. Restlessness is a key warning sign in critical care. It may indicate pain, anxiety, hypoxia, or delirium. Pain may be verbal or behavioral: grimacing, guarding, withdrawal, crying, or agitation. Never assume pain is absent because a patient is silent. Pain management includes both pharmacological and non-pharmacological methods. Medications include non-opioid analgesics, sedatives, and anxiolytics such as benzodiazepines and propofol. Non-drug measures include environmental modification, reassurance, relaxation, and patient education. Effective pain control prevents complications. Delirium is an acute disturbance of consciousness and cognition common in ICU patients. It may present as agitation, confusion, or withdrawal. Management includes identifying the cause, optimizing oxygenation, managing pain, reducing noise, and providing reassurance. Advanced nursing goes beyond routine care. It involves complex clinical judgment, evidence-based decision-making, ethical reasoning, and leadership. Advanced nurses integrate research, clinical expertise, and patient values to deliver high-quality care. When cure is no longer possible, care does not stop. Palliative care focuses on comfort, dignity, symptom control, and emotional support. Ethical principles, autonomy, beneficence, non-maleficence, and justice guide all decisions. Critical care nursing demands skill, vigilance, compassion, and ethical judgment. Advanced nursing means seeing beyond the monitors, to the human being and their family. I'm Nurse Succinate. Thank you for learning with me. Keep growing. Keep caring.